Building a human from scratch takes a massive biological toll. Even under standard conditions, carrying a single baby demands incredible metabolic energy, bringing a predictable wave of exhaustion, morning sickness, and growing discomfort. But sometimes a mother hits those physical milestones months ahead of schedule. She finds herself profoundly exhausted, unable to keep food down, and physically feels way too big, way too soon. The division of a fertilized egg, or the implantation of two, immediately accelerates the mother's internal timeline. That cellular split generates an immediate compounding impact on her physiology, magnifying every standard response of a singleton pregnancy. It raises an interesting question. In those early weeks, we're talking about adding just a few extra ounces of cellular material. How does something so small trigger such an aggressive, magnified physical reaction? The answer lies in the mechanics of gestation. A multiple pregnancy doesn't invent new symptoms. It takes standard physical responses and amplifies them through three distinct biological multipliers. The first multiplier is chemical. To sustain two fetuses, the body has to build two placentas, or one incredibly large one. That extra placental tissue acts like a heavy-duty factory, pumping massive amounts of pregnancy hormones directly into the bloodstream. Look at this graph tracking human chorionic gonadotropin, or HCG. While a singleton pregnancy shows a steady climb, hormone levels in a twin pregnancy rocket upward, hitting higher peaks incredibly early. Since HCG is thought to be the primary driver of morning sickness, that extra spike has immediate consequences. The twin hormone line aggressively crosses the severe nausea threshold, while single pregnancies stay underneath. The resulting nausea can be unrelenting. For many mothers of twins, this progresses into Hyperemesis gravidarum, a state of severe, continuous vomiting that causes rapid dehydration and weight loss, frequently requiring hospital admission to stabilize. Those elevated hormones also pull heavily on the body's energy reserves. Spiking progesterone, combined with the doubled metabolic demand of building two humans, triggers intense early-onset fatigue, along with severely pronounced breast swelling and tenderness. The mother's entire chemical baseline runs hot. Standard first trimester discomforts transform into a debilitating, high-intensity state. Then we hit the second multiplier, pure physics. Adding a second baby, a second placenta, and double the amniotic fluid forces a rapid spatial expansion inside the abdomen. Doctors track this expansion through fundal height, measuring the uterus to gauge gestational age. With twins, you get a classic size date discrepancy. As this diagram shows, a mother at 20 weeks with twins possesses a uterus identical in size to a 24-week singleton pregnancy. That rapidly expanding uterus has nowhere to go but up and down. Pushing upward, it compresses the diaphragm, causing early shortness of breath, and violently squishes the stomach to trigger intense heartburn. Pushing downward, the extra weight crushes the bladder and the pelvic floor. This guarantees constant urination and creates deep, aching pelvic pressure weeks ahead of schedule. That same downward mass compresses the major pelvic veins, blocking efficient blood return from the lower body. This vascular traffic jam inflates varicose veins, swells the legs with edema, and causes painful hemorrhoids. Inside all of this crammed architecture, the mother will eventually feel the unique mechanical sensation of two separate bodies, noticing distinct kicking in completely different areas of her abdomen at the exact same time. The mechanical reality of twins outpaces the body's natural adaptation timeline. The physical architecture hits its limits months before the babies are actually due. The third multiplier moves beyond physical space and targets the body's systemic resources. A twin pregnancy forces a massive increase in maternal blood volume to meet intense biological demands. Producing blood for two fetuses creates a siphoning effect. The double demand for iron and folate quickly depletes the mother's nutritional reserves, leading to high rates of maternal anemia, leaving her pale, dizzy, and experiencing heart palpitations. This chart highlights the incredible strain placed on the mother's circulatory system. This high-pressure environment drives a double to triple higher risk of developing preeclampsia compared to mothers carrying a single child. Preeclampsia is a severe complication characterized by spiking blood pressure and protein leaking into the urine. Warning signs include severe headaches, sudden swelling in the face and hands, and visual disturbances like flashing lights or blurred vision. Simultaneously, the overstretching of the uterine muscle fibers agitates the tissue. This prompts the body to start firing off practice Braxton Hicks contractions earlier and much more frequently. The compounded strain of low iron, high blood pressure risks, and constant uterine tension means the mother's internal organs operate at absolute red line capacity right out of the gate. Before modern imaging is even considered, these exaggerated symptoms serve as the primary indicators for an obstetrician that the pregnancy has deviated from the norm. Clinicians identify the classic triad: a fundal height consistently measuring larger than the dates suggest, excessive nausea, and the physical palpation of multiple fetal parts, or 2 heartbeats with distinct rates. Identifying these clues is critical because the physical stretching and systemic exhaustion lead to one major high-stakes consequence: a massively increased risk of preterm labor. Looking at the standard gestation timeline, signs like regular contractions, low backache, and pelvic pressure often arrive before 37 weeks. Because of this, the average twin delivery lands in this 36-week window, while singletons reach the 40-week finish line. As intense as they are, these symptoms and clinical signs only raise suspicion. Absolute proof of twins always requires a definitive diagnosis via ultrasound. Connecting the feeling of being too big too soon to its biological source provides the necessary medical foresight to manage the higher risks associated with a multiple pregnancy.